Good afternoon, everyone. Thank you for being with us here on this pretty Monday afternoon. We were with you on Friday, but for those of you that are regulars, you know that on Friday we were at Bi-State taking a look of the new at the new electric buses. So that was a bit of a field trip. 14 new buses, electric buses, being delivered to Bi-State. They had a couple of them there on Friday. They're being outfitted. Folks are being trained. And they'll be on the roads, probably late in the winter, early spring, February, March timeframe. The first of the buses, and these are the double buses, will be running on Grand, which is our busiest bus line. It's the number 70 on Grand. So that's what we did on Friday. We didn't talk too much about COVID on Friday. But today we have three things that we'd like to visit with you about. One is COVID. Second is some new CARES Act funding that I am asking the Board of Estimate and Apportionment to consider on Wednesday. We have a special meeting on Wednesday at 11 in the morning. And then, of course, we're going to talk about the election briefly. So, beginning with COVID, I have to tell you, our numbers are really not good. Last week we had 504 new cases in the city of St. Louis. 4 weeks ago, the week ended October the 11th, we had 270 cases. And if you go back to the lowest week that we had was just 7 weeks ago, where we had 203 cases reported in 1 week. So now we have over 500 cases reported in last week, ended yesterday. So our numbers are up. Our R-naught factor is up above 1. The average number of people going into the hospital in our region, not the city, in our region, is now at 59 per day. There was a period of time where that was 30 a day, give or take. So we are having a lot more community spread of COVID. What we know from the contact tracing is that this is happening in homes. It's happening at your house. It's happening among your neighbors, among your family. It's getting together. It's happening in small groups, but it's happening across the spectrum. The most cases, South St. Louis has the highest number of cases. I'm looking for the map for the, pardon me, 1 minute. So 63116, 63109, 63139, 63118, all of those have high cases. Now those are densely populated areas, zip codes. As a result of that, we are opening tomorrow, in conjunction with the state, additional testing at the Affinia, I'm sorry, I couldn't spit that out for a minute. At the Affinia testing site, 3900 block of South Broadway. They have been doing testing all along, but we're adding additional resources there, combining with the state and the National Guard beginning tomorrow. So please go online if you feel that you need to get a test. Go online, sign up for that. Testing, finding the positive cases. We've been doing a good job at testing, but we're finding a lot more positive cases. So a lot more people positive, a lot more people in quarantine. There's literally not a nook or a cranny of this city that it is not affecting. And it's not especially happening in bars or in restaurants. It's happening in small private groups. People who get 10 or 15 folks together just to, because they want to see one another. So that's where it's happening. We are very concerned. I talked with Dr. Eccles this morning, and he said there were 2 places that he's especially concerned about right now. One is some of the Greek life parties or get-togethers that are happening in and around college campuses. concerned about that. He's working with the universities to try to curb that. And he's also expecting in about a week, by the end of this week, we'll begin to see the uptick in cases again because of the get-togethers that happened on Halloween. And businesses is not where it seems that this is happening. It's happening in small social gatherings. You know, honestly, there's no rule that we can put in place that can keep people from getting together with their neighbors at their house or in their backyard. So we're just asking you, please tighten up those groups. As you're thinking forward to the holidays, Thanksgiving's only 3.5 weeks away, I guess. You know, be sure that you're keeping your group small, and I know that's very tough, but our numbers are really very seriously up when you consider it's 150%, our new cases in the city are 150% more than they were just 7 weeks ago. So you can see what the seriousness of this is. So it's up to each one of us to do our part, and to not be getting together with other folks. And by the way, yes, the highest percentages are still people in their 20s and 30s. So that's still the case. So that's it for COVID today. Just to say to you, please, get serious about this. Our hospitals are almost full, and they are not accepting, some are not accepting transfers from outside of our area because they just can't. So there'll be more on that. You'll hear Dr. Garza, I think, is going to be talking at 3:30 today, and you'll hear more about what he has to say. But please. Okay. On next subject, a little bit better, and that is that on Wednesday we have a special E&A meeting, and it's at 11 o'clock on Wednesday. It's not our normal 2 p.m. time, 11 o'clock on Wednesday, and I'm asking the Board of E&A on Wednesday to allocate an additional $500,000 towards Heat Up, Cool Down St. Louis to help people with their utility assistance. That's on top of the $3 million that we've already allocated to them. That $3 million is supposed to last through next year, through 2021. And just because of some of the funding, they've already gone through $1 million, and they've got pledges out there for another $500,000. So we need to fund that so that that's funded by the end of the year. We're asking for an additional $680,000 to go to child care centers, daycare centers. We have to be able to somehow keep daycare centers open. Parents have to go to work. They need a safe environment for their kids, and the daycare centers have reduced the number of kids that are coming every day because of COVID so that they can maintain good infection control. So we're asking for $680,000 to help a few more of the daycare centers. And we're also asking, I'm asking the Board of E&A to allocate $1.2 million in additional small business assistance. That's on top of the $4 million that we allocated a couple of months ago. And with a particular look towards helping those businesses that are in the hospitality industry, restaurants, event spaces, folks that have been very significantly impacted by the occupancy limit of 50%. You can only have 50% of your normal occupancy, and as well as the earlier closing times. So those, I'm asking for the Board of Estimate and Apportionment on Wednesday to consider allocation of that. The city has spent or committed virtually 100% of our CARES Act funding. You may have noticed that last week I met with our delegation, state reps and state senators from the St. Louis region to try to update them and have them help us get additional funding from the state. The city of St. Louis got only, our people got 50% less than St. Louis County residents. Let me give you the numbers. St. Louis County got about $175 per person. St. Louis City got $116 per person. That's because of the way the state allocated the money. St. Louis County got it directly from the feds because they had over 500,000 people. City of St. Louis and the other 112 counties in the state of Missouri had to get it through the state, and the state kept some of those funds. So we're asking for those additional funds, at least the 17 million, so that we can do more rental and mortgage assistance, more help for small businesses, more utility assistance, and all more testing, all of the things that we need, because most of us probably thought that when you're thinking about how you were thinking about COVID 4, 5, 6 months ago, you didn't think we'd still be in this really incredible situation that we're in right now with very high case numbers, but we are, and so we need additional funding to get us through that. So that's what we're doing at E&A. And then lastly, tomorrow's election day. I know you all know that. I think most of us are happy that election day is here, and that tomorrow, or soon, I should say soon, we'll know the results of the election. Let me just say that our elections, our polling places here, we have about 100 polling places in the city, are going to be safe, they're fair. Police will be in and around the vicinity, lots of poll workers in and around the vicinity. Be sure to keep your distance when you're waiting in line. We don't know how long the lines will be tomorrow. I know today, I just heard anecdotally from a couple of friends who texted me to say that, you know, they were waiting in some pretty long lines at our 5 remote voting locations. Tomorrow's gonna be a beautiful day. We hope everybody will come out and vote. I think an interesting little statistic for you, for those of you who like numbers like I do, 43,000 ballots have already been cast in the city of St. Louis. Now, 4 years ago, in 2016, the presidential election there were a total votes cast of 133,000. 4 years before that, it was 144. And in 2008, which was Obama's first election, there was 159,000 cast. So I'm sure that tomorrow there'll be at least 100,000 people probably voting tomorrow. So I think you can expect certainly some lines, particularly because this is a very long ballot. There is, hang on a minute. Do I have it right here? What did I do with it? Well, never mind. On my laptop?
Yep.
There it is. Sorry, I could have brought that over here, but this is the ballot printed out. I suggest that if you haven't taken a look at it, you do so now, because it's a long ballot. It has all the state offices on it. It has all the state reps on it. It has, in our area, 1 state senator on it. It has all the judges, well, half of the judges, but that's a whole page right there. And then it has a number of constitutional amendments: Constitutional Amendment 1, 3, Proposition D, Proposition 1, Proposition R, Proposition T. So if you don't know what those are yet, just take a quick look at the ballot, go on the election board website. Very easy to pull up the sample ballot. It's going to take you a little bit of time to vote, especially if you haven't read the ballot before you get there. So there'll be a lot of voting tomorrow, and you know, it's unclear when we'll know the results. Hopefully by tomorrow night. Excuse me. Hopefully by tomorrow night we'll know the results of the Missouri elections. I don't know if we'll know the results of the national election or not. But I know that our election board and election boards across the state of Missouri are geared up to handle this volume. And so I would expect that we will have results, maybe late tomorrow night, maybe early the next morning. But election boards across the state will be working around the clock to get this right. So polls are open. I think you know this, but 6 a.m. to 7 p.m. on Tuesday. If you are trying to vote early today at one of our 5 locations, they are open till 5 o'clock. So that's Julia Davis Branch Library, Schlafly Library, Central Library, and Booter Library. They're open till 5 o'clock today. So I would suggest if you're going to go vote today that you might want to get started. Might want to head that way. Because some of those places have lines as well. That's good. We want everybody to vote. So we're thrilled about that we do have such a big turnout. But we're also trying to have people be prepared for that. So those were the 3 topics I wanted to cover with you today. And I bet we have some questions.
A few questions, Mayor. So first off, 2-part question. Do you anticipate that the city of St. Louis will be implementing new restrictions if cases continue to go up? If so, what type of additional restrictions are you even considering right now?
So we've been talking a lot about that because, as you know, our cases are just climbing and climbing and climbing. Weather's gotten cold, people have gotten sick and tired of following the rules, and the combination of those things together is really causing the spike. So when you consider that, the contact tracing is indicating that it's happening in homes, happening in neighborhoods, happening among family members. When you consider that, what rule could we put into effect that could impact that? Not many. We wouldn't want to, and we can't come into your homes. So I think the levers are not. There are not many of those levers that we could put in place at this time. We're taking a strategic approach in working with the universities. For example, St. Louis University, Washington University, some are going to be recommending that maybe young people don't go home for Thanksgiving. That would be tough. We know that. But maybe stay in place. St. Louis University's winter break starts right after Thanksgiving. So those kids will be home till after the first of the year. So we're working with those universities and others. UMSL, which is not located, as you know, in the city of St. Louis, but nevertheless, working with those universities to try to get them to message to their students about the importance of not getting together, having parties, get-togethers, that sort of thing, because it's spreading there. So we're thinking hard about that, and any additional restrictions that we put in place, we want them to be able to be effective. And so it's things like we're, knowing that people got together over Halloween. You can tell just by looking at social media, and expecting that we may see a spike at the end of this week, and then looking forward to Thanksgiving when we all want to get together with our families. But better to keep it small this year. So.
JJ has a question about hospitals. Do you have a snapshot about ages or some of the demographics of people who are going into the hospitals? Are they nearing capacity? And what does it mean if they do in fact become full?
Hospitals are nearing capacity, and they are thinking about cutting back on some of the elective surgeries. They are thinking about cutting back on visitors, some of those kinds of things. And so they are looking at that. They are also being very careful or limited about any transfers that they might take. So all of those things are being managed by the hospital system, but they're all concerned. And they're not just concerned about the number of beds, JJ. They're concerned about their staff. Their staff's worn out. Their staff's tired. And so it doesn't just take a bed, it takes the people to take care of folks. So the hospitals are managing that. The city of St. Louis, and this was as of Saturday, I think was the number, of the people that are in the hospital, and I don't think I gave you that number today, but I will have it here. There were, hospital numbers are 2 days old. There were 416 people COVID positive in our hospitals in the region, along with another 85 people that were suspected to be positive for COVID. So 500 people in the hospitals just a couple of days ago. And that compares with, let's see here, on October 1st, 376. So there's another 125 people in the hospital today, more than there were a month ago. So hospitals are very concerned about that, and they're limiting transfers, and but people still get sick. People still have heart attacks. They have strokes. They have cancer. They have serious illnesses. There has to be room for those people in the hospital. 35 people out of the 416 people that are in the hospital, 35 of them, their homes are in the city of St. Louis. So the city of St. Louis is actually doing better than outlying counties in the area in terms of per capita. But we still have to, our numbers are still going way up as well, so have to take precautions.
Bars and restaurants, Mayor, do you foresee any changes to the 11 p.m. curfew and capacity restrictions?
Changes or up or down?
Either or.
Either or. Right now, we're going to hold steady with that because we don't believe that most of the transmission is happening in bars and restaurants. And so we're going to hold steady right now with that. There's no way for us to lift the closing time or increase the occupancy right now when you look at these case numbers. Would we consider even less occupancy and an earlier closing time? It's been suggested. We're trying to avoid it. That's the way I'll leave it.
A few more questions, Mayor. We did get a question about the additional money for small businesses. One, do you think the 1.2 million will help businesses get through winter? And two, what is the status of the additional or the original 4 million that was originally invested?
The original 4 million is all spoken for, and it's either already, most of it's already gone out to businesses, or maybe a few that haven't received their checks yet. But the vast majority of that 4 million is gone. Do I think another $1.2 million will be enough to keep businesses through the winter? No, but I think that it'll be a help, and the combination of the plans that the businesses will put in place, I think in this case, every little bit helps. If we could get that additional $17 million from the state of Missouri, we'd put some of that into small businesses also. But right now, we've spent our $35 million, with very little contingency left. So we think every little bit helps, and we're going to do as much as we possibly can.
You sort of brought this up, but the state heads into special session on
The 5th.
the 5th. What are your thoughts about what the city stands to gain out of that? How do you think the state will be able to help the city with additional funding?
Well, we're asking the state, and we're asking our state legislators to help us get that additional $17 million that, had we been in St. Louis County, we would have gotten. So that's number one. I don't know at this point exactly how that will go, but certainly we need the help of our state representatives and our state senators to help us get those funds.
Two more questions. We got a question about election day tomorrow, safetiness of going to the polls. Is SLMPD and poll workers trained and ready? Should there be voter intimidation at the polls? Are you concerned about rioting or anything like that happening, violence after the election?
So yes, it'll be safe for you to go to the polls. We are taking steps to be sure that the polls are adequately staffed and that SLMPD is nearby in the event that there is voter intimidation. We don't have any real reason to believe that there will be, but we just know that tempers are high. Everybody's on edge. I mean, all you have to do is look at the rhetoric on social media, which is as bad as I have ever seen it, with, people cursing other people on social media and just, so everybody's on edge. So we are aware of that, of course, and we're taking those steps. With regard to protests or demonstrations tomorrow evening, we do know that there are demonstrations planned for downtown tomorrow evening, Wednesday, Thursday, and into the future, pending the results of the national election. We don't expect any violence, but we are certainly prepared and have a lot of measures in place to try to keep everybody safe, keep protesters safe, keep police officers safe, keep buildings protected, because we don't want any of that either. So we're very aware of that and have a lot of measures in place.
Last question of the day comes from Nathan. So looking to the future, Mayor, if the recession continues, what is the city's plan to tackle affordable housing, making more affordable housing available, especially for seniors and maybe the disabled?
So Nathan, we are, have approximately $7.5 million this year earmarked for affordable housing. We also have close to $20 million, $22 million, I think is the number, for homeless prevention. That's, a lot of that is rental and mortgage assistance, utility assistance, and emergency housing for homeless, and getting folks then moved into transitional and permanent housing. So we're spending a huge amount of money. St. Louis has a lot of affordable housing, not necessarily housing that's government owned or subsidized, but housing that is good, solid, decent housing that is at an affordable rate. And so we have that, and coupled with the funds that we've received from the federal government, CARES Act, we want everybody to be able to have a good, safe, stable place to be.
It's 2:30, Mayor.
It's 2:30, guys. Thank you all for being here this afternoon. We'll be back and talk with you in a couple of days. Keep your groups small. Wash your hands. Stay socially distanced. This is serious. Thank you all.